Joining me right now is Health and Human Services Assistant Secretary, member of the White House Coronavirus Task Force, and four-star Admiral Brett Giroir. And Admiral, it's great to have you on the program this morning. Thanks very much for joining us.
Thanks for having me.
So I saw you this week on the task force at the podium, the task force speaking out about what is happening. Give us your sense of where we are today, Admiral, because of course the president has really become, in terms of addressing this crisis, has been using words like horrific, the worst 2-week period. Can you set the stage in terms of where we are this Wednesday morning with the coronavirus?
So this indeed will be a very grim week for many parts of the country where we're seeing the peak death rates from coronavirus. Now, what I want to explain and I want people to understand is the people who are unfortunately in the ICU and are facing really life-threatening struggles, they were infected 2 or 3 weeks ago. So we have to understand that although the peak of the illness is now, we do see a light at the end of the tunnel. The social distancing, the physical distancing is working. We're seeing a fall in the rates of new infections being diagnosed. Hospitalizations are leveling off, and this is really reflecting all the positive effects. So although this will be a very serious week or two in most parts of the country, we do see the light at the end of the tunnel. That's very important. If we keep our foot on the gas, continue the physical distancing, all the things we've been talking about, we will get over this peak and we will be back to our relatively normal America very soon.
And your colleague, Dr. Deborah Birx, this week said, look, try to stay away from grocery stores, avoid pharmacies. Is that just because she doesn't want us around with other people, or is there something we need to understand about the air? Is there something in the air in terms of walking around in a grocery store?
No, there's really nothing in the air. It's all about physical distancing, and I'm the kind of person who loves to go to the grocery store every single day in a normal time. My wife and I do. That's a great activity. But now you really shouldn't. Only the person who really needs to go to the grocery store, go to the grocery store. Make that once a week or once every 4 or 5 days. It's just exactly what we've been saying all along. Avoid unnecessary social interactions. And when you're in the grocery store, you may be touching surfaces that hundreds of other people have touched. You may be near another person at the counter. This is just a normal precaution. I don't think there's anything new she was saying. Just minimize to the degree. But please, if you need medications and you have to go to the pharmacy, go. If you need groceries, you need to do that. Just do it carefully.
Yeah. Admiral, as we try to look toward an opening of the economy, obviously we need to understand who's had it, who hasn't had it. Admiral Giroir, President Trump spoke out yesterday on the testing during the coronavirus briefing. I got to get your take on testing. Here's what the president said.
1,870,000 tests to date. And now we're performing them at a level that nobody's ever seen before. CVS testing sites in Georgia and Rhode Island will be using Abbott Labs' rapid 5-minute test. That means a lot of very fast tests. No nation in the world has developed a more diverse and robust testing capacity than the United States.
I understand that now we've got the testing underway, but there are others who tell me we still cannot get past go on this testing. Tell us about the pace of the testing, and also, will we get to a place where we will have to know who's had it, who's been inoculated, who doesn't have it? Somebody mentioned to me the other day there's going to be a data crisis. We're going to have all that data, and maybe there's something that you put on your phone where you say, yeah, you know, I've got the inoculation passport, I've been tested, I'm good to go, I can go back to work. How are you going to deal with all of that?
So really, really great question. So all the tests to date have really been testing, do you have the virus? Are you actively infected with the virus, and can you shed it and give it to other people? And again, as the president said, we've almost done 2 million tests by now. We know that's an underestimate. That continues to grow as more and more of the industrial might of the country, the CVSs, the Walmarts, the big labs, all really have this at a very large scale. We're also getting the rapid point of care tests. As we move into reopening the country, there's another kind of test called an antibody test. This is relatively old technology. It doesn't tell you if you have the virus now. It tells you, did you have it in the past, meaning you are likely immune. This is a whole separate type of test that we believe will be available literally in the tens of millions in the first months it comes onto the market, which will be very, very soon. So this will be able to tell you, have you had it? Are you likely immune to it? And are you really, likely very safe to go back to work and not risk exposing other people? So you're going to see these tests mix over the next month, where we're still going to be actively surveilling for people who may have the active virus, but we're also going to be testing literally tens of millions of people as we get back to work to understand if they had it and are they immune. And one subtle point, the more people who have had it, again, I don't want anyone to get sick, anyone to die, but the more people who have had it that may have been asymptomatic, that starts to generate a herd immunity. And it makes it much more likely that people can spread it next year. But we just don't know that. Is it 1%, 5%, 10%? Because there's so many people, we believe, who may have very mild cases or completely asymptomatic. The antibody test will tell us that.
And if you are asymptomatic but you have it, that can be transmitted to somebody else, like your elderly parents, and you may not even know it, right?
That's really correct, and that's why Ambassador Birx has been really so adamant and passionate about imploring the younger generation to socially distance. I would say physically distance. You have to be socially distanced, FaceTime, all the kinds of things we interact with. That's great, and that's needed for our emotional support. But physical distancing is important. Yes, you can be asymptomatic and spread the virus. Now, that spread is probably a lot less because you don't have as much virus and you're not coughing and sneezing and being real symptomatic. But yes, you can still spread the virus. That's why we don't want you to visit elderly people because you might feel fine, but you could spread it to them and they could become severely ill or even have a fatal case.
All right, Admiral, thanks very much for the advice and for joining us this morning. Great conversation. Admiral Brett Giroir joining us. We will see you soon, sir.